Heart disease. Heart disease is the leading cause of death worldwide, responsible for millions of fatalities every year. It primarily happens when fatty plaques build up in your arteries, a process called atherosclerosis. Over time, these plaques restrict blood flow to your heart muscle. If a plaque ruptures, a blood clot forms, completely blocking the artery and triggering a heart attack. Without oxygen, heart tissue begins to die within minutes. To avoid this, your primary defense is managing blood pressure and cholesterol. Cut down on saturated fats, trans fats, and processed sugars, which accelerate plaque buildup. Incorporate at least 150 minutes of moderate cardiovascular exercise every week to strengthen your heart muscle and keep blood vessels flexible. Avoid smoking entirely, as nicotine damages the lining of your arteries and makes blood more prone to clotting. Regular screenings for blood pressure and lipid panels can catch early signs before symptoms appear. Stroke. A stroke is essentially a brain attack occurring when the blood supply to part of your brain is interrupted or severely reduced. This deprives brain tissue of oxygen and nutrients, causing brain cells to die in a matter of minutes. Ischemic strokes happen when a blood clot blocks an artery leading to the brain, while hemorrhagic strokes occur when a blood vessel ruptures and bleeds into the brain tissue. The single biggest controllable risk factor for stroke is high blood pressure, which places constant strain on arterial walls. You can drastically lower your risk by reducing sodium intake, maintaining a healthy weight, and managing chronic stress, which spikes blood pressure. Limiting alcohol consumption is also critical, as heavy drinking elevates stroke risk significantly. Recognize the signs using the acronym FAST: facial drooping, arm weakness, speech difficulty, and time to call emergency services. Immediate medical intervention with clot-busting drugs can minimize long-term brain damage. Lung cancer. Lung cancer is the leading cause of cancer deaths globally, characterized by the uncontrolled growth of abnormal cells in the lungs. These cells form tumors that destroy healthy lung tissue and eventually spread to other parts of the body, disrupting vital organ functions. The absolute primary cause of lung cancer is cigarette smoking, which exposes the lungs to dozens of known carcinogens that permanently damage cellular DNA over time. To avoid lung cancer, the most effective step is to never smoke or to quit immediately if you do. Even years after quitting, your risk drops substantially. Additionally, minimize exposure to secondhand smoke and environmental hazards like radon gas, asbestos, and heavy air pollution. Testing your home for radon, an invisible and odorless radioactive gas that leaks from the ground, is a simple way to eliminate a major hidden risk factor. Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that makes it increasingly difficult to breathe. It encompasses conditions like chronic bronchitis and emphysema, where the airways become inflamed and the tiny air sacs in the lungs are destroyed. This reduces the amount of oxygen that can enter your bloodstream, leaving you constantly fatigued and breathless. Like lung cancer, the leading cause of COPD is long-term tobacco smoking. To avoid this debilitating condition, avoiding tobacco smoke is non-negotiable. If you work in industrial environments, always wear appropriate protective gear to avoid inhaling chemical fumes, dust, and heavy particulate matter. Staying active also helps maintain lung capacity and muscle efficiency, making it easier for your body to utilize the oxygen it does receive. Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that causes the brain to shrink and brain cells to die. It's the most common cause of dementia, continuously destroying memory, thinking skills, and the ability to carry out simple daily tasks. The exact cause involves the abnormal buildup of proteins in and around brain cells, forming plaques and tangles that disrupt cellular communication. While age and genetics play major roles, you can reduce your risk through lifestyle modifications. Engaging in regular physical exercise boosts blood flow to the brain and encourages the growth of new neural connections. Keeping your mind active with mentally stimulating activities, maintaining strong social connections, and eating a Mediterranean diet rich in antioxidants and healthy fats also provides significant protective benefits for cognitive longevity. Type 2 diabetes. Type 2 diabetes is a chronic condition that affects how your body metabolizes glucose, the vital source of fuel for your cells.
In type 2 diabetes, your body either resists the effects of insulin or does not produce enough of it to maintain normal glucose levels.
Chronic high blood sugar damages blood vessels and nerves throughout the body, leading to heart disease, kidney failure, blindness, and lower limb amputations. To avoid type 2 diabetes, focus on maintaining a healthy body weight, as excess abdominal fat heavily drives insulin resistance. Adopt a diet centered on whole foods, fiber, lean proteins, and complex carbohydrates, while strictly limiting sugary drinks and ultra-processed foods. Physical activity is equally crucial, as muscles use glucose for energy and inherently become more sensitive to insulin during and after exercise. Colorectal cancer. Colorectal cancer begins as small, non-cancerous clumps of cells called polyps that form on the inner lining of the colon or rectum. Over several years, some of these polyps can mutate into malignant tumors that invade surrounding tissues and spread throughout the body. To avoid colorectal cancer, regular screening is your absolute best defense. Starting at age 45, routine colonoscopies can detect and remove polyps before they ever have the chance to become cancerous. Dietary choices also play a massive role. Consuming a high-fiber diet packed with fruits, vegetables, and whole grains keeps the digestive tract moving efficiently and reduces inflammation. Conversely, you should heavily limit your intake of red meat and heavily processed meats like bacon and sausages, which have been directly linked to increased colorectal cancer risk. Kidney disease. Chronic kidney disease occurs when your kidneys are gradually damaged and lose their ability to properly filter waste and excess fluid from your blood. When kidney function drops too low, toxic wastes build up in the body, leading to fluid retention, cardiovascular failure, and death unless treated with dialysis or a transplant. The two primary drivers of kidney disease are high blood pressure and diabetes, both of which damage the delicate filtering units inside the kidneys over time. To avoid kidney disease, managing these underlying conditions is vital. Keep your blood pressure and blood sugar within target ranges, limit your sodium intake to reduce strain on the kidneys, and stay properly hydrated. Avoid the chronic, unmonitored use of over-the-counter pain relievers like ibuprofen, which can cause direct toxicity to kidney tissues when taken frequently over long periods. Accidental falls. Accidental falls are a leading cause of unintentional injury-death, particularly among older adults. A fall can result in severe trauma, such as traumatic brain injuries or hip fractures, which often lead to a rapid decline in health, prolonged immobility, and fatal complications like pneumonia or blood clots. To avoid fatal falls, regular strength and balance exercises such as Tai Chi or resistance training are incredibly effective at keeping muscles and joints stable. Ensure your living environment is free of hazards by removing loose rugs, clutter, and exposed electrical cords. Install bright lighting throughout the home, especially in hallways and stairwells, and add secure handrails and non-slip mats in the bathroom. Regular vision checks and medication reviews with a doctor can also prevent dizziness and spatial disorientation. Road traffic accidents. Road traffic accidents claim over 1 million lives every year globally, causing fatal blunt force trauma, internal bleeding, and severe neurological damage. The vast majority of these accidents are entirely preventable because they stem from human error and behavior. To avoid fatal road accidents, strict adherence to traffic safety laws is paramount. Always wear your seatbelt, as it keeps you secured inside the vehicle's protective frame during an impact. Never operate a vehicle under the influence of alcohol, drugs, or extreme fatigue, which drastically slow reaction times and impair judgment. Eliminate all distractions by keeping your phone out of reach while driving. Finally, respect speed limits and adjust your driving habits to account for adverse weather conditions like heavy rain, ice, or dense fog. Liver cirrhosis. Liver cirrhosis is the late stage of scarring of the liver caused by various forms of liver diseases and conditions. As healthy liver tissue is continuously replaced by scar tissue, the organ loses its ability to filter toxins, process nutrients, and produce essential proteins, eventually leading to liver failure or liver cancer. The most common causes are chronic alcohol abuse and non-alcoholic fatty liver disease, which is driven by obesity and poor diet. To avoid cirrhosis, limit your alcohol consumption to moderate levels or choose to abstain entirely. Maintain a balanced diet and exercise regularly to prevent excess fat from building up in your liver cells.
Additionally, protect yourself against hepatitis viruses by getting vaccinated for hepatitis B and avoiding the sharing of needles or unprotected contact with bodily fluids. Hypertension.
Hypertension, or high blood pressure, is frequently called the silent killer because it rarely produces noticeable symptoms while quietly causing massive damage to your cardiovascular system. The constant high pressure of blood pushing against your artery walls forces your heart to work much harder and weakens blood vessels throughout your body, directly causing heart attacks, strokes, aneurysms, and kidney failure. To avoid hypertension, significantly reduce your daily sodium intake and focus on foods rich in potassium, magnesium, and calcium. Maintain a consistent routine of cardiovascular exercise to keep your blood vessels elastic and compliant. Limit alcohol intake, avoid smoking, and practice effective stress management techniques, as chronic stress hormones keep blood vessels constricted and blood pressure elevated. Breast cancer. Breast cancer occurs when cells in the breast tissue mutate and grow out of control, forming tumors that can invade surrounding tissues and spread to distant organs. While risk factors like genetics and age cannot be altered, early detection and lifestyle choices significantly influence survival outcomes. To avoid advanced breast cancer, regular screenings through mammograms are essential, as they can identify tumors years before they can be felt by hand. Lifestyle modifications that lower your risk include maintaining a healthy body weight, particularly after menopause, as fat tissue produces estrogen, which can fuel certain types of breast cancer. Limiting alcohol consumption and staying physically active also lower circulating hormone levels and reduce overall inflammation in the body. Pneumonia. Pneumonia is a severe infection that inflames the air sacs in one or both lungs, filling them with fluid or pus. This causes severe coughing, fever, chills, and difficulty breathing, preventing adequate oxygen from reaching the blood, which can be fatal, especially for infants, the elderly, and those with weakened immune systems. To avoid pneumonia, vaccination is your most powerful tool. Vaccines are readily available for pneumococcal bacteria and the influenza virus, which frequently leads to secondary bacterial pneumonia. Practice rigorous hand hygiene by washing your hands frequently with soap and water to stop the spread of respiratory viruses. Avoid smoking, as tobacco smoke damages the natural defense mechanisms in your respiratory tract, making it much easier for bacteria and viruses to settle into your lungs.